we'll leave those open and then we'll display the results for you. So I'd like to introduce Lisa Lachance and Faye Johnston, who are presenting today's webinar on LGBTQ2 plus inclusion in health and social services. Faye and Lisa will be taking over the presentation now, and they will be introducing themselves. So I will sign out and I'll be here, and if you have anything technical, just let us know. So with that, I will stop sharing and allow Lisa and Faye to go.
Perfect. Thank you so much for introducing us, and thank you for bringing us on board for this webinar. I'm now going to see if I can make my screen do the thing that your screen was doing, which I think I know how to do. And there we go. I would say like nod your heads if you can see what's on my screen, but I can't see your faces. I just get to look at myself and my coworker. So if anything comes up, just shoot us a message in the chat and we will make it work for all of us. We will do some introductions of ourselves in a moment, but I want to first, again, say thank you and just kind of try to introduce a bit of what we're talking about today. Oh, perfect. Everyone is able to see what we're talking about. This is great. So we're coming together today to talk about LGBTQ2+ inclusion in health and social services. The intention of this workshop or webinar is to give you a bit of like broader understanding of the realities of LGBTQ communities, shift then gears to think a bit about how we conceive and think about gender and sexuality, and then move intentionally into practice-oriented tips, tricks, and recommendations that you can actually bring into your work in a way that is hopefully useful to you, that is applicable to your work, and all of that fun stuff. So now, this is just a short overview of our agenda. If questions come up, I think Lisa and I both love, like, we're very creative facilitation nerdy. And so if you have a question at some point, shoot it into that Q&A or ask in the comments and we'll do our best to address it then. Your question can actually be, Faye, please speak slower, because we all know that I speak really quickly and that's not always great for folks. Lisa, does this make sense for you so far?
Yep, that's great. We can go to the next slide.
Awesome.
And just to echo Faye, I was just so glad to see people popping in already in the chat function. So please don't hesitate to do that. So I'd just like to acknowledge we're presenting on behalf of Wisdom to Action, and we are honored. Wisdom to Action is based, and I live and work in Chibukta in Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. Yesterday was Treaty Day, which is a celebration for everyone. We are all treaty people and live in this territory under the Peace and Friendship Treaties of the mid-1700s.
And on my end, I am based in Ottawa, which is unceded, unsurrendered Algonquin territory. And I think when we talk about gender and sexuality, it's important to make those connections between how the ways that we think about these concepts are actually linked to colonial ways of being and can actually be a continuation of violence in and of itself. And so I think I challenge us as we share space together for the next hour or so to think critically about that as well, and about moving beyond that acknowledgements and seeing how we can really do the work that we do better in ways that are more inclusive and supportive to us LGBTQ folks, but also Indigenous folks and intersections thereof. There we go. So we love a discussion-based and interactive facilitation. Webinars can be tricky on this note because you see us, but we don't see you. But please, as we've seen in the chat already, chat away, ask us questions. We really think that that helps us make sure that the content we're presenting to you actually meets what you're looking for, meets your needs, and is applicable to you and your workplace. We are also very big fans of creating safer and braver spaces, within the understanding that we all have different lived experiences and different access to knowledge. And so I would challenge you to do the best that you can to engage safely and inclusively, but also don't be afraid to ask that uncomfortable question. That question that's sitting with you and making you squirm a little bit, because I think we need to have those conversations to really move forward somewhere and move forward productively. And lastly, discomfort is actually a really good and healthy thing to sit with when we talk about communities that experience violence. A lot of the time when we talk about inclusion, we make it very like pretty and loving and warm and fuzzy. And that's good to some extent, but we also need to realize that we live in a world that isn't great to a lot of different people. and actually sit with that, particularly when we are coming from identities and social locations where that discomfort is a choice that we can step into, as opposed to something that characterizes the everyday lives of different groups and communities. So all of that is my preamble. We're now gonna actually let you know who we are. And I think I might, since I'm talking a bunch, let Lisa kick it off here.
Sure. Well, I'm Lisa Lachance, and you can see me live and in photo there. I'm the president of Wisdom to Action Limited, and I'll tell you a bit about Wisdom to Action in a minute. I'm actually in my doctoral studies in health at Dalhousie University, and I'm looking at how the engagement of community-based organizations and youth mental health services can support better outcomes for young people. I'm interested in children's rights, youth engagement, community development, and obviously queer rights as well. I have 2 youth. I'm the proud parent of 2 youth, and that's how you can find me in other ways and on Twitter and through email.
Awesome. And my name is Faye Johnstone. I'm a senior associate with Wisdom to Action, who again, we will tell you more about in a moment. For this webinar, I was the project lead on one of the main projects that we want to talk with you folks about today, which was around LGBTQ2+ youth and gender-based violence. With and outside of my work with Wisdom to Action, I do a lot of LGBTQ inclusion training with health, social, and youth services, often focused around the particular needs of trans young folks, but also working with any organization that will bring me in to talk to them about making their services and approach more inclusive. I am also currently hanging out on Carleton University campus in a wonderful room in the Graduate Student Association's office. And I am pursuing my Master's of Social Work here for the next 11 months, and then I am free to go back into my career path. If you'd like to follow myself or Lisa on Twitter, you can see our handles there as well as our emails. And then our Wisdom to Action Twitter handle is just at Wisdom to Action. Perfect.
And then just quickly, a little bit about Wisdom to Action. We started life as a national knowledge mobilization network funded through the federal government, and worked focused on the youth serving sector across Canada and supporting the increased use of engagement and evaluation and other community development tools within that sector. When our federal funding was sunsetting, we became a social enterprise. So that means that we work we provide services and then hopefully generate enough capacity to support organizations who wouldn't otherwise be able to work with us and to support community projects. So this year, our social enterprise commitment has been with Family SOS, which is a local Halifax-based organization. And you can see a little look at what we do: evaluation, engagement, knowledge mobilization, and creative curation.
Perfect. So we want to kick it off by talking a little bit about the context of LGBTQ2+ communities today, just because I think it's important to ground ourselves in why we are talking about this issue and how it's relevant to the work that all of us engage in across health and social services. And then that will inform the work that we do moving forward to think more about gender and sexuality from a theoretical lens and then practical lens. So this is, I jokingly refer to as my sad slide. Which I think is important because I think it's important that we actually pause and think about, again, like the realities of these communities. And so those realities are not as pleasant as we might think they are. Half of trans folks in Ontario make under $15,000 a year. That means that 50% of Ontario's trans population actually lives below the poverty line. That also means that they're more likely to experience unstable housing, more likely to be unable to make their ends meet at the end of the month, and a lot of other issues that when we think about public health more broadly are generated by the inability to make a living wage. We also know that 2/3 of trans folks avoid public spaces because of fear of violence and discrimination. So a lot of trans folks just aren't going outside, are being very intentional about when they leave the house and how they can guarantee their safety when they do. We also know that trans or LGBTQ young folks are significantly overrepresented in our homeless or unstably housed population, with estimates ranging from 20 to 40% of young folks who are homeless identifying as LGBTQ2+, a significant portion of which are believed to be trans folks. 70% of trans youth have experienced sexual harassment, and 47% of trans young people between the ages of 16 and 24 seriously considered suicide within the past year. These are really sad statistics, and I think they paint a really stark picture. But more broadly, at the end of the day, LGBTQ folks are experiencing a lot of difficulties in their lives with higher rates of mental health problems, high rates of suicidality, homelessness, high rates of poverty. These realities are very much felt both in the statistics, which convey, again, that stark picture, but are also the lived realities of communities that we are a part of communities that we are intimately connected to, and that we know these issues aren't just statistics, but they're a part of our everyday lives. So when it comes to the statistics, I always love my statistics slides because I think they're important. I think they demonstrate something that folks need to see. But I think we can also talk all day about these statistics, but they can't really convey the realities of the lives and experiences of LGBTQ2S plus communities. And so what I mean by that is I don't think they convey the fact that folks like me have to worry about our safety whenever we leave the house, that we go through a process where we reflect on what are we wearing and how likely are we to experience harassment because of what we're wearing, where we have to be intentional about going home late at night, we have to be intentional about what washroom we're going to use. Again, statistics say a lot, but these statistics, the truths that these statistics point to, shape the everyday lives of our communities in some really difficult, unpleasant ways. But I also don't want to entirely cast LGBT communities as like inherently marginalized, because we know that's not what it's about. And so my point with these slides is just to demonstrate the higher rates of difficulty and struggle, but not to demonstrate that these communities are inherently so, but that the reality that we live in creates a context where these communities are more likely to experience violence.
And so one of the things that we wanted to talk about today was to look at a project that we led over the past year on behalf of the Public Health Agency of Canada. We were contacted by FAC. They wanted to do a national consultation with LGBTQ2 plus youth around their experiences of gender-based violence, but also what their priorities were for change. And I think we'll come back to this at the end of the presentation, but I think it's even how you lead engagement processes and engage communities in this type of way. So one of the questions I had for FAC at the time, for instance, was sort of what happens next? So if we engage people, engagement to sort of what end? Because what you're asking people to do is obviously it's an investment of time, but it's an investment of energy, and that these are really serious topics. And to be honest, we didn't know what FAC was going to do with this information. There was no guarantee that it led to a next step. But I did, we convened the Youth Advisory Committee for Wisdom to Action, who all really felt that this was an issue that young people were passionate about, and that wanted to talk about, and that really there had been so little engagement around the stories and experiences of young people that it was important to do this work. And so under Faye's leadership, we were able to have a youth-led process in terms of the actual project management, the development of an online survey. We had a discussion guide and could support young people to host conversations in their communities or in groups that they already met in around some of the key topics and key questions. We invited people who had participated in any way in the initial sort of conversations and data collection to actually meet on a Zoom call like this. We did sort of a rolling afternoon of hour-long analysis sessions where we presented sort of the initial findings, and young people were able to reflect on what were priorities for them, what resonated with them, what that meant to them in their own lives. And then a smaller group of youth were involved in taking that analysis, building it into recommendations, a draft report, as well as a script for a video that we produced. And so I think that process in and of itself was a valuable one. And again, when you're thinking about, doing youth engagement, community engagement, how can you make it genuine and as impactful through process and not just an outcome. And so I do think, I mean, we were overwhelmed by the response online in terms of the survey. We had a short period of time to do this work, and very quickly we heard from over 500 young people, and we had in-person sessions in a number of communities. You know, I think looking through the data that we collected and the responses, you know, we really heard again and again in terms of unsafe streets and the experience of street harassment, and also how street harassment, I think Faye started to talk about this, how street harassment opens up other types of violence in terms of the types of choices that you make if you don't feel safe in being able to be, you know, to sort of transport yourself and that sort of thing. That there were still unsafe family environments, unsafe experiences in health services, social services, and community services, and unsafe schools. And I will say that also, you know, with that impact on services, so young people having experiences of discrimination and harassment and violence in those settings, then also, even if a service is well set up to respond, just generally creates a sense of uncertainty for young people when they're going to seek services. And so I think that's really, you know, we're really able to hear the voices and the stories from young people about what the effect is of gender-based violence, what their experiences of gender-based violence. And I think it's also really, you know, I think we've seen a lot of change in terms of queer rights and queer community and the capacity of broader systems to be responsive and inclusive. But, you know, this, I mean, from what we heard, this really was the first time that young queer people have been asked about their experiences with gender-based violence and their priorities for ending it. And, you know, similarly, we also did a project last year called Rainbow Health with the Mental Health Commission of Canada, and that report and those videos can be found on the MHCC's website. And again, that also seemed like one of the first times that people had been convened in that way. So we've come a long way, and there's a long way to go, particularly in making safe spaces for young people. Faye, I'll turn it back to you, I think.
Yes, indeed. So I think the intention of that report was to just demonstrate that the LGBTQ communities are still having a hard time. I keep bumping up against this impression that we have in Canada of how inclusive and wonderful this country is, and I think it's important to just unpack that and realize that that's not actually everybody's lived experience on this land and in the society that we live in. So now that we've shifted the gear, we've talked a little bit about the context of LGBTQ communities. We want to shift gears now to explore gender and sexual diversity, what it means, what it looks like. And I think for me, a lot of this is where the real value lies, because I think we're going to get into practical pieces, but if we as service providers can just unpack our own presumptions around gender and sexuality, I think that framework is more productive and effective than any list of checklists, toolkits, any specific recommendations, because I think it's really about how we approach the work that makes the biggest difference more often than not. And so to talk about that, it's also important to think about the normative understandings of gender and sexuality in this world. And so when we think about gender and sexuality, you know, when we live in this world, from the day we are born, we are all presumed to have a particular life path that we will follow. That life path includes growing up and dating people of the opposite gender. That includes everybody identifying for their whole lives as the gender that they were assigned at birth. And it requires that everyone is able to be placed into either a straight male or straight female box. Now we know that that's not how everyone thinks about gender and sexuality. That's not the world that we live in necessarily today anymore. But these normative concepts still very much are significant in our society and are still things that we are all in the process of unpacking and addressing. Now we can accept a lot of diversity outside of that. We can see that, you know, society has a lot more acceptance for sexual and gender diversity now than before. But at the same time, we're still treating those differences as anomalies, as folks who are welcome to be included, but who are different from us nonetheless, as rather than actually unpacking how the way that we think about gender and sexuality excludes those folks fundamentally. And now the most important thing here is that even as we are unpacking and challenging these assumptions, we need to look at how the way that we build services and provide services from the very get-go is often about designing them around the norm, designing them around like the average client, as opposed to designing them around people from marginalized groups. I think I've heard in like communications speak that they call it like designing programs around like norm, who is your average and middle class, cisgender, heterosexual, white man. And I think that while we're like, again, I'm debunking that and moving beyond that, I think it's important to actually sit back and look at our services from the lens of somebody who might be poor, racialized, queer, and trans, and what that would look like for them. So this is actually our first attempt at a poll. I'm hoping it will go well, and I believe it will. And so I think my first question for you is, what is gender to you? How would you describe or define it? That isn't like, there is no correct answer. Gender is weird, it is creepy and complicated. And so I'm actually really curious to hear what you folks think. If you dislike all of the options that we drafted, you are very welcome to send them in the comments. Mm-hmm. And keep in mind that we're not saying that this is what gender has to be, it's about how we perceive or think about gender.
And maybe while people are answering the poll, I can also hop in. I see one question came in through chat and one question through the Q&A. So one question was around the experiences of senior LGBTQ2 plus populations. So that we haven't, I'm just starting to do some work with Dr. Jackie Gahagan here at Dalhousie University, looking at these issues. So I think some of our comments around services are applicable across the lifespan, but we haven't done any projects to date that focus on that population. And I do know that one participant offered a webinar series that sounded really good. So check that out in the Q&A. And then one person had a follow-up question around the GBV project with FAC, which was around the minimum age of participants. And we largely, we're talking about 12 to 25-year-olds. And I think that was really who responded to surveys and the in-person sessions. So, all right.
So we have some results. I'm not sure if everyone can see these, but I'm going to assume that you can. And so we have a lot of folks who are saying that gender to them means a social construct. Some folks are talking about how it means something different for everybody. Some folks are saying how it's all of the above, which I think is also maybe like none of the above, so it's kind of both. And then some folks are saying that it's rooted in biology. Oh, and thank you to the people who are letting me know that you can indeed see all of the things. So I love asking this question because I think there are no wrong answers. I like to, I have my own personal way of engaging and thinking about gender, but I think we all do, and we have a right to that. We all have our own relationships with our bodies, relationships with the genders that we hold dear to ourselves or that we really don't care about that much. And so gender is both everything and nothing. And I do go along the lines of calling it a social construct. And the reason for that is because if we can't all create if there is no universal definition of gender, if we all define it and describe it differently, then it's not actually something you can reach out and touch. It doesn't like physically exist if it looks and is expressed and felt differently by different people. And the same thing with sexuality. And so these things, I think it's most useful to think of them as social constructs, while acknowledging underneath that they can mean and look very differently for different kinds of people across time, across cultures and communities. Now, I like to describe these things as socially constructed, but I also think it's important to think of them as deeply personal as well. Now, the reason for that is when we say social construct, you know, I think, okay, like it's a social construct. Who really cares? It's not like we can just like get rid of that. It doesn't matter. We can just call ourselves inclusive and go to town. But I also think that our genders really matter to us. We live in a world where our lives are shaped by how people perceive our genders, and how we identify and articulate and express our own. And so gender is something that is socially constructed, but it also matters to us. And I know that because every time, as like we live in a world where women experience sexual harassment, street harassment, and that's because of their gender identities and their gender expressions. And I experience those same things because of my gender identity and my expression. And so it is important to us, and it does matter, even though it is a social construct. Now, when it comes to gender and sexuality, one of my favorite things is thinking about how new these concepts actually are and how they haven't actually always been that way. I should have done a poll here, but I didn't think to. But my favorite example is the colors pink and blue. So as soon as I say pink and blue, most folks are like thinking like, okay, what does pink and blue stand for? You think pink means girl, blue means boy. But if you actually go back a century or even 50 years, that wasn't the case. Pink was actually the boy color because it was closer to the color of blood. And blue was actually the girl color because it was perceived to be softer and more mild. And I think that is really interesting if you pause for a moment and reflect on that. Because no matter how much work we've done to unpack gender and sexual stereotypes, when we see a baby that's wearing blue or a baby that's wearing pink, we automatically, even if we're not like accepting those assumptions jump into our minds. But despite how quick that and how instinctive that feels, those are actually really recent changes. Pink a few decades ago didn't mean what it does to us today. And so I think that's a really interesting example of how much gender and sexuality is changing, but also of how deep-seated these norms become to us, even though they're very recent. And I think it's a demonstration of just how powerful socialization is and how powerfully entrenched these gender norms are to this day. Now, when we think about gender and sexuality, it's also important to think about how these concepts have evolved in the last 100, 200, 300 years. What I mean by that is that if you go back 20 years ago, we weren't necessarily in places where a woman could wear jeans to the workplace. And how today we actually know that that's relatively acceptable. We are in a place now where we have men who are allowed to express their genders in more feminine ways than they were before, and are celebrated and accepted for that. But if we go back even further, we know that different cultures and communities around the world for centuries on end have had distinct ways of describing, thinking about, and expressing gender and sexual diversity. We have this instinct to look back at time and describe anything that we would call like LGBTQ behavior, gay or trans or all of those things, but that's actually not entirely accurate because those were cultural distinctions and distinct cultural understandings of what gender and sexuality might look like outside of the way that we think and talk about it now. When it comes down to it, again, I think gender is socially constructed. I think it's deeply personal as well, but regardless of your perspective on it, it does really impact how we are perceived, how we exist in this world, and how the world treats us in general. I wish a lot of the time that I could forget about my gender. I would really love to stop talking about my gender. It would be a good time, but I can't do that in the world that we live in. And so regardless of where we're trying to go with our gender systems, we need to acknowledge just how deep-seated and violent that they can be to us, because that's the only way that we can actually do the work to unpack these systems. Lisa, do you have anything to add at this point?
No, I mean, I think that was a great overview, and I do think, we get into it in a slide along the way, but this idea of gender as not being socially constructed and not fixed is really important. Then when we think about how we consider trans people, what we think when someone, are they trans enough, and how do you get to call yourself that, and that sort of thing. So we'll cover that a bit more in a different slide too.
Okay. Oh, did I do that? Yes. Awesome. Was this your slide, Lisa?
I think this is your slide. You might have skipped past the slide with some terms on it.
Oh, I did. Yes.
Yeah.
Okay.
Yeah, and I think we're going to do this one together, but we just wanted to, I think it is important to think about some of the key terms. And I'm actually going to start halfway down the list. And this is one of my sort of favorite sort of personal stories in terms of the evolution around sexual orientation and gender identity and conceptions around that. So the identity of being bisexual had actually, it never felt like it quite described how I saw myself in the world. But I had no other way of describing it. There were no other terms that seemed to make sense. I would use queer, and that was pretty good. I was pretty comfortable with that. But honestly, I think it's probably only been 5 or 6 years ago, probably was 5, I have to admit, that I saw the word pansexual and thought, what is that? I don't know what that means. And I had the experience of looking it up and thinking, that's it. That's what I mean. And so for me, so in terms of, you know, bisexual being someone who's attracted to people of 2 different genders, so thinking about genders in terms of male and female, and pansexual, you know, attraction and connection with people regardless of gender, and perhaps also not seeing the gender binary. And so that was a really important part of being able to self-define. And so I think this is where terms and you know, we don't, you know, labels are, you know, sort of can be a blessing or a curse, but I think it's so important that when you find the words, and so as our vocabulary has been expanding and our understanding has been expanding, it actually does create a much more healthier place, I think, for individuals. And so I don't know if we want to run through each of these terms, but I would just say too that if you hear terms, if you have clients coming in to seek services and they identify in ways that you don't know what that means, to you know, look for ways to find out what terms mean, and also the importance of using those terms. That really, to really respect how people self-identify, because it really goes to the core of their being and feeling safe in the space they're in.
Yeah. So I'll go over like a couple of them really quickly, and then I think we have a couple questions. So I think some of them are pretty, we know them relatively well at this point. Straight is attraction to people of the opposite gender. Gay is attraction to people of the same gender. There's a question around bisexual around, like, I think bisexual and pansexual are both described in a lot of different ways that sometimes overlap a bit. So like I identify as bisexual, I'm also non-binary. And so like to me, it's attraction to my gender and other genders. And so it depends on the person. But I think there is a lot of space within each of these definitions to make those definitions your own. Queer is an umbrella term that is also an identity label that is basically used to describe folks who are not cisgender and or heterosexual. So if you're not either of those things, you can have a good time with that term. The one that I want to take a second on is trans or transgender. Trans is a descriptor of your gender experience. So it's not like a gender identity in and of itself. So you're not like a trans person, you are like a trans man, a trans woman, a trans non-binary person, etc. But at the end of the day, the way that I define trans that I think is the most inclusive to everybody is someone whose gender identity, so who they know themselves to be, is different from the gender they were assigned at birth. So when you're born, the doctor gives you like a blue blanket and wraps you up and brings you out to your parents. And if you don't identify with the gender that they assigned you in that moment, you fit under the broad trans umbrella. Now, within trans, there's also non-binary, and non-binary is another umbrella term that works as both a umbrella, but also as a personal identity label. Non-binary at the end of the day means that you don't identify within or wholly or completely as either male or female. So if we think of gender and gender systems as 2 rigid boxes, you are one or the other, non-binary means that you don't completely fit into either of those. You might feel like a little bit of one or a little bit of the other, and that depends on the person, but it means that you don't wholly fit into either. Now, on the other hand, we have cisgender, which I know that there's a question about as well. Cisgender is a term that was actually created for a very particular reason, because for the longest time, the only language that we had was trans people. And we actually use slurs as opposed to trans, which is a good word. But we didn't have a word to describe folks who weren't trans. And the importance of that is that if we're talking about violence and power dynamics, we need to name the group that has power in particular situations. And because that is a way of destabilizing them as like the normal people. Because if we don't have a word for it, we just call them normal. And what does that say about trans people? It calls us abnormal. And so cisgender describes someone whose gender identity is the same as the gender identity they were assigned at birth. Now the last one is two-spirit. Two-spirit is an umbrella term as well. It includes a lot of gender and sexual diversity. And it was a term that was created in the 1990s at a conference that actually took place in Winnipeg of Indigenous LGBTQ2S two-spirit folks. who were looking at their cultures and the languages that their communities and cultures had had to describe gender diversity and sexual diversity. And it was created as an umbrella term to capture that diversity. Because different communities and cultures had different language across nations and across communities on Turtle Island. The important thing to note with this language, or with Two-Spirit, is that it is exclusive to Indigenous folks. So as white folks or as folks who aren't Indigenous, it isn't our language to use or take because of the fact that it is rooted in a particular culture and cultural experience. I'm seeing a question here around a term that, like different terms to use to describe the full community. I think that we'll never be at a point where we have all of the perfect definitions. There's always, everyone's always like trying to find a new word. At the end of the day, I think the best thing you can do is go with the language that works for you. There is like better or like broader language like LGBTQ2S or 2S LGBTQ+ that works for a lot of people and captures a lot of identities. But we'll never be in the perfect situation because language is evolving and changing, and we will never have all of the solutions.
And I think too, I'm just going to read it out loud just so that if you're not reading the chat, you know what the question was. But a term that's been brought to our attention is rainbow community, because there's not a clear understanding of the acceptance of queer community. And I think as well, you know, I think this is where building from relationships and building your capacity as an organization. So actually, you know, the people in your organization can come up with the term that most fits for them in their context. So, I mean, I think rainbow community is fine, but I don't know if everyone would like it, basically. So I think you know, working from your own community to identify the terms you use is really important.
Yeah. Now, so when I do these workshops with service providers, I actually hate my definition slide because folks want like a comprehensive list of every gender identity and sexual orientation that's ever existed. That list does not and never will exist. And within each of these terms, different people will describe them very, very differently. If we all look at each other and just like try to define our sexuality and gender, we will come up with a million different answers. And so these definitions are useful to ground us in some common terminology, but those definitions can never supersede or replace how individuals describe their own genders, their own sexuality, because their experience is, they have the right to define their own experiences however they would like. Now, when it comes to gender and sexuality, I'm going to use this wonderful little gender unicorn. Not everyone loves the gender unicorn. I also don't actually love it, but it's a useful tool just to break things down a bit. Because I've thrown a few ideas at you so far, from gender identity, gender expression, sexual orientation, and then everyone always has the where does biology fit in question. So gender identity, just to go through it, is your inner sense of your own gender. It is basically, if we all look deep within ourselves, we have some idea of who we are and how our gender impacts us and what it actually means to us. It's different to other people, to everybody, and a lot of folks who aren't trans haven't had to sit and think about that. But it is still something that is deep within each and every one of us. Now, separate from that, so entirely on a different spectrum, is gender expression. And that is how we demonstrate or express our genders. Gender expression is about the clothing that we wear. It's about the really nice face of makeup that I wear every day. It's about really sparkly thingies. It's all of those things that are coded in ways of demonstrating our gender to the people around us. The important thing to think about here is that if our gender identity is not intrinsically connected to our gender expression. We can identify as a woman and really, really love playing football. We can identify as a man and really love wearing dresses and lipstick. We know that the idea that people have to ascribe to rigid social norms around gender is sexist. We know that men can express themselves and women can express themselves in 100 ways. And it's important that we include trans people in that as well, because there is no right way to be a trans person or to be a person of any gender. Now, sexual orientation is kind of like the third spectrum or little universe that's happening as well. And it's basically, it depends, it's who you're attracted to. It doesn't have any intrinsic connection to your gender identity, but the language that we use to describe our sexual orientation often is connected to our gender identity, such as language like gay or lesbian. But it depends on the person, and LGBTQ folks come in a wonderful diversity of gender and sexual orientations. The last thing is biological sex. And this is one that folks always feel like they have a lot of oh God, I don't know how to deal with this. And my response to that is usually that there are two instances where your biological sex matters. When you're going to visit the doctor and when you are really hoping to go home with somebody that evening after a night at the bar. And that's more or less it. Our bodies don't actually impact the violence that we experience a lot of the time. It does on occasion, but when somebody is enacting violence against somebody in public, for example, they actually don't know what your body looks like. They know how you are being coded by society. They know how you're expressing your gender, but that's actually not rooted in your biology. And so biological sex has a place. It is a thing that is important to a lot of folks, but it is not intrinsic to, it is not as, we place more value in it than we should when the way that society engages, perceives, and treats us is very much based off our gender identity and gender expression. Okay, so I'm looking at my time here. I'm gonna move us a couple slides ahead. Yeah.
Yeah, I think the only thing that, you know, from the slide that just went by, and it's important as we transition into thinking about services and that sort of thing, you know, I think, and I mentioned this earlier, so, you know, that trans people transition in all kinds of ways, but, and there's no set path and there's no checklist that people have to pass. And so, and I think that links to another point around identity is not a phase or a fad. And that it's just, you know, again, really important. Sorry, I made you go back to the slide, Faye. And so, and that, you know, accepting people and supporting and then thinking about how your services can support people to identify how they want to, and how important, you know, having that inclusive approach from the start is to providing effective services. So, you know, as a parent and perhaps as a person, maybe it's the same, but, you know, I spend a lot of time filling out different, you know, intake forms and signing people up for different programs. And I spend a lot of time emailing people, calling people, writing things on forms to say, like, you know, you just asked for, you know, myself as a parent to identify as a mother or father, and to identify my child's gender identity using biological sex terms. And that it just, you know, is, but I mean, all of that is, you know, and sometimes I don't, because all of that's kind of exhausting. But I mean, just to think about, that's when people are coming to work with you, when people are coming to seek services, that's been their daily experience. And so the more you can do to make sure that you're not asking people to explain their gender identity or sexual orientation as they walk in the door, and the more that you make everything an option and you reflect that in everything you do, I think the more effective services are. Sorry, you can keep on.
No, you're great. So I think we're going to shift gears now to be a bit more practical and give you some tips, tricks, and tools that might be useful in your work. But before that, I just want to keep in mind that our understanding of gender and sexualities are always changing. Our definitions and our models of understanding gender and sexuality are great and useful, but they can never capture a full diversity. And that at the end of the day, individuals are the experts in their own experience. They know their lives best, and listening to them and centering their needs is the best way to provide inclusive care. I find that a lot of the time when we talk about LGBTQ inclusion, we get really scared. We think of it as this like really complicated process where we have to like learn 100 different terms. We have to do all of these different things, when at the end of the day, trans and LGBTQ inclusion is about respect for diversity. It's about respecting bodily autonomy and the right that folks have the right folks have to do what they want to do with their bodies. It's about centering the individual as the best expert in their own experience and wrapping our care around those individuals. It's about being accountable and empathetic when we make mistakes. And it's about doing the best that we can to bring excellence into our work. We get so afraid of LGBTQ inclusion. We make it out to be so much more than it is. At the end of the day, like, there are ways to do it better. There's ways to improve our practices. But if you default back to these values that already shape our own approaches, that already shape the work that we all want to do in caring sectors, we are on the right track. We make it complicated. We make it more complicated than it has to be. And it is complicated, but it's also about values and principles that we've all been doing and that we're all deeply committed to every day that we're in our workplaces. And so, at the end of the day, inclusive care is meeting people where they're at, avoiding imposing our ideas on them, acknowledging them as the experts, and centering our care around their needs.
And so I think, I think part of that process, as Faye was talking about, is becoming, setting a standard of using values to set your standards of care and to develop your processes. So whether you're looking at your governance, your service provision, how you welcome volunteers, and everything in between. So starting with seeking education, thinking about your own assumptions. We all are in the same society. And I think if, I need to unpack the assumptions I have around gender and sexual orientation every day as well, because of course we are all receiving the same messages. So it is a learning journey. And so I think it's just, some key ones around not assuming gender or sexual orientation, and then starting from the get-go, as I said, avoiding using gendered language, so people feel welcome as they walk in the door.
Another one that comes up a lot is around pronouns, particularly when it comes to trans and gender diverse folks accessing your services. Pronouns at the end of the day are just a replacement for names. They are like a stand-in when it's referring to somebody in the third person, and it's easier to just say like he, she, or they. But at the end of the day, pronouns are also an important way of respecting identity. It is a way of saying, I see you for who you tell me you are, and so I'm going to refer to you with language and words that I know that are respectful to who you are and how you want people to describe you. We know fundamentally that pronouns can't be assumed based on how we present or express our genders. We know that men, women, and people of diverse genders express ourselves in 100 different ways. And if we can challenge the stereotype that women have to be super feminine, we also need to realize that that means that nobody of any gender identity should have to appear in any particular way. And what that means is that when we see somebody, we can't know what their gender identity is or what their pronouns are just by looking at them. When it comes to bringing this into your workplace, there are some really useful tips and tricks to do that. The first and biggest thing is providing opportunities for people to disclose their pronouns and disclosing your own. What I mean by that is if you're doing a go-around in your workplace, or if you're leading a youth group, introduce yourself saying, hi, my name is Faye, I use she and they pronouns, and my favorite color is blue. If folks would like to go around and say their name, their favorite color, and throw in their pronouns if they'd like, you're good to go. That is a way of normalizing it and providing opportunities for people to disclose without requiring that they do so. You can also add it to your email signature. You can get buttons and stickers that include it. Doing these small things, which are genuinely at the end of the day really small steps, help demonstrate to trans and gender diverse folks that they are welcome and supported in your workplace and in the services that you provide. Now, when it comes to pronouns, the other thing is to embrace gender neutrality when you don't know. And so when I'm doing like workshops in the same room with people, this is the point at which I say, has anybody seen me use gendered language at any point during this training? And their answer is always no, and they're always kind of surprised by that. We have a hard time learning or embracing gender neutral language, but it's a lot easier than we think it is. My favorite example is when it comes to slang, we move slang in and out of our vocabulary every seeming week or two, and it becomes instinctive and it's easy. And so I think for pronouns, we just have to commit ourselves to it. If you spend a week reframing every time that you assume somebody's pronouns based off their gender expression and just thinking they in your head instead of he or she, you'll realize very quickly with what speed it becomes normal. The last thing with pronouns is that there's more of them than you think. The ones that we all have heard of at this point are he and she, he, him, his, she, her, hers, they, them, theirs. But there's also pronouns like ze and zer. There's pronouns that are actually they and fair. There's millions of pronouns out there. And if your instinct is, oh God, those are hard to learn, my response is that people's names aren't always easy to pronounce. And we do the work because we know it's a good way of demonstrating respect to pronounce people's names correctly. And pronouns are essentially just stand-in names. It's not always easy, but if you actually commit yourself to it, you will learn and adjust more quickly than you can expect.
There's a very practical question on the Q&A, Faye. What suggestions do you have for respecting pronouns when writing for a website? And I'm not ignoring the other questions that I see popping up here, but I wanted to pop that question in just quickly.
I think honestly, just using, like, you can use they, them. It works, it's used, it's like the Webster's International Dictionary certifies it as a word. I think that is the best practice because it is inclusive of everybody. It is less clunky than using like she/he. And it respects the fact that gender diverse folks are hanging out and always have been.
And there's another question that Anna Ryan put in that is such a big question, but how do you see gender and sexuality evolving in the next 50 years? And I haven't been ignoring it. I think it's perhaps maybe what we want to do is get through some of our content and then maybe we can come back to it. I think it feels like a huge question. And there was also a question around suggestions or recommendations for a faith-based health organization, where the fear that you mentioned is heightened and historic. And I do think that I would say that perhaps for faith-based health organization, the fear is heightened. But I would say, based on our work with the Rainbow Health Project, with the Mental Health Commission of Canada, and with the Gender-Based Violence Project, I would say that, there's actually not a lot of services aside from the very specific queer organizations, and even then, people don't assume that the organization is capable to respond appropriately at every level to all issues around sexual orientation and gender identity. I think we're all on a learning path. I think the fact that you recognize that there's perhaps a specific challenge for faith-based organizations, is really part of the important first step. But I think most young people, particularly those who experience violence or experience other types of marginalization and oppression, approach most service situations with some apprehension. And so, I think the things that we would say around making sure, you're committed publicly to an inclusive approach, that you have that stated, but also, a way of taking feedback and comments and that sort of thing is really important. And I think everything we've been talking about in terms of getting the pronouns right, to, working in solidarity and partnerships with queer folk in your organization is really important.
I think on the faith-based side, I would just say, I think the best, if you're coming up against barriers, reach out to faith leaders who are LGBTQ in your community. I've seen that work really well. And there's actually, I don't know if you folks are spread out across the country, there's some really good Toronto-based organizations that are LGBTQ focused around different faiths. There's Salam Canada, based in Toronto, like reaching out to those folks and working with them. Because I think that, I am not a religious person. I can't talk through scripture and LGBTQ identities, but finding folks who have done that work and thinking is really useful. I'm also seeing a question here around, there was a question that I'm working in an emergency center for abused women and children. I think the question around how do we respect trans folks while running a shelter that is only for women, my response to that would be that trans women are also women. And also, if you're serving women, they should have equal access to those spaces. And that is actually something that is protected by our human rights legislation. That doesn't mean that it's always going to be easy. We know that staff might have their own perspectives. We know that clients might have their own perspectives. But if we're coming at it from a human rights lens, we have a duty to accommodate these people. And trans women in particular are very unlikely to experience inclusive access to any other shelters. I cannot imagine if I was fleeing abuse, I would not go anywhere near a men's shelter. I would not even want to imagine the kind of violence that might happen to me in those spaces. And so I think we need to think about that when it comes to including trans folks in gendered spaces. When it comes to the housing sector more broadly, my recommendation is to center the needs of the client. There will be times when a trans man, so someone who's assigned female at birth but identifies as a man, might feel safer accessing a woman's shelter. I think that that, again, might cause a bit of a ripple, but having conversations that acknowledge the fact that that person might be safest and feel safest in that space, as opposed to a men's shelter where they might experience more violence, I think that is what we have to center in those discussions.
So Faye, it's Greg, I'm going to jump in for 1 second. Hey everyone, we're just coming up on our 1 hour mark. We're going to go over a little bit. I want to be respectful of Faye and Lisa's time, but also give you a chance. So we are recording. We'll do a little bit over, but I know people have other things to go on to, especially Faye. I know you have class this afternoon, or you can skip. But so we'll go for a few more minutes, but please ask your questions, and we will probably end when I get the signal from Faye and Lisa that it's time. So, okay, thanks to everyone.
We will, being mindful of the fact that folks do have other things going on today, we're gonna jump a little bit through.
And just to say there's some questions that came up around other languages and gender neutral pronouns like French, and I see Lynette has hopped in from the MHCC to talk about some work that you did around thinking about using gender neutral pronouns in translation. So, and Lynette has provided their email address at the Mental Health Commission of Canada, so people can contact them there. So.
Also, hi Lynette.
Yeah, I'll just summarize. It's great. People are problem solving and offering resources to each other, which is just excellent. And I know this is being recorded. I don't know how these questions are captured, but hopefully those resources could be added to the webpage as well.
I'm gonna do this slide in like a Cliff Notes version. The point being that a lot of the time we presume that all LGBTQ2S people are, one, visibly presenting as such, and two, out as such. That is not remotely the case for a lot of people. A lot of people are in the closet. A lot of trans folks are also what we call stealth, which is a term used to describe trans folks who are like passing as the gender with which they identify. And so I think it's important in our services that we be very intentional about not disclosing gender and sexual diversity information without explicit consent. This is particularly true in cases where folks are accessing vulnerable or like care or services that are based around being at risk of violence or marginalization, because the worst thing that we can do is out somebody who is like out a kid who to their parents when they might be accessing our services to help them like deal with their mental health when they're not out at home. Like that can be like difficult for us to, on a policy level, deal with. But at the end of the day, I would point folks towards the Toronto District School Board, where they have some really great policies around protecting gender identity and sexual orientation. And then I would also say that the human rights legislation in Ontario and Canada does allow you to protect that information. You are never required to disclose gender and sexual identity information to parents, because children have a right to privacy just like everybody else does.
Great, thank you. And so what should we do, Faye, in terms of timing?
I think we have like 3 more. How about I'll do this slide because it's my favorite slide. Okay. And then I can send it over to you for the last slide about next steps.
That sounds great.
Perfect. So this is like, I find, so I'm studying to be a social worker, and so I'm allowed to say this. We are terrified of making mistakes. We are like gut-wrenchingly afraid of putting our feet on our mouth. We are, it's like the biggest thing often that I find gets in the way of supporting trans and LGBTQ communities. Because we feel like we don't have enough knowledge, we don't have enough competency, we don't have enough comfort, that we just don't do it, or we paralyze or we freeze in those moments when we do make mistakes. And so this is my slide that is, I'm gonna read out to you quickly and then slowly. Yes, you will make mistakes. No, your mistakes don't make you a bad person, but yes, it might hurt us and we might respond with that in mind. But honestly, that's not an inappropriate response. And yes, we want you to move on because it's not actually about you in that moment. And yes, you can learn and improve and do better, but at the end of the day, we need you to keep trying. Human beings are imperfect. We always have been and always will be. And so we will always make mistakes. My favorite example is that I am trans, my partner is trans, and I have used the wrong pronoun to describe him on occasion. And it's a mess up and it's awkward and it's uncomfortable, but if I can make that mistake, folks who aren't trans are going to as well. And so yes, you will make mistakes. That doesn't make you a terrible person because we're imperfect beings. But that mistake does cause harm. When we think about trans folks, Trans folks often get misgendered, so have the wrong pronoun used to describe them almost every day of their lives. When I leave the house, I go to a coffee shop and I experience misgendering. When I walk from that coffee shop, somebody says something or looks at me weird, and we are acutely aware of that violence. And so if you make a mistake, it might not actually be that mistake that is causing us to have an emotional response. It is actually because that mistake is a continuation of a daily violence that is linked to a systemic violence that shapes our realities. And so no, it's not an inappropriate response if we are emotionally triggered by the fact that you used the wrong name or pronoun, or that you said something that was not the most inclusive. In those moments, I beg you for a bit of empathy, because we are doing the best that we can to survive in a world that isn't great to us, and we need you to be there for us in those moments when we are in pain. But yes, we also want you to move on, because it's really awkward if we spend 20 minutes after you make a mistake talking about how sorry you feel for making that mistake. Because no, it's not about you, it's about the harm that you caused to us, and our needs need to be centered in those moments. But at the end of the day, yes, you can learn and improve. We have come so far. When I see like young 15-year-old trans kids in high schools who are like living their best life, I am in awe and I am so hopeful. We all need to keep doing this. We need to keep learning and improving, and we need to keep trying as hard as we can, because that is where the magic happens. Now, our last few slides were around shifting from individual to collective and changing the pace from, individual staff competency to how organizations can embed inclusion. I am going to jump ahead, I think, because I don't want to hold you folks for long, but we will share the slides following this. But the biggest thing is think about engaging LGBTQ communities in your work, bring them to the table and build relationships with them. Think about inclusion not just as a workshop, but as a whole process and as a cultural shift, where you make sure that it is embedded every single step of the way for new, current, and former and ongoing staff people, where everyone knows that these are your values. And share power with LGBTQ youth. And Lisa, I'm sorry.
No, and I mean, I had flipped ahead too to try and summarize those key points that I think we want to bring forward. And so I think definitely partnership and solidarity. So, and that takes time to build trustworthy relationships that then you do share power. When we talk to people about different types of inclusion and engagement, again, like you said, people are afraid to make mistakes. There are various models of valid types of engagement and inclusion that can move an organization along the way. I think it's really important to be clear and transparent about what resources you have available, what the intention is, and then to also think about things like evaluating your impact, so you can think about what worked and what didn't and what more needs to happen. And that is about centering the experience of queer folk. And I think also dedicate resources to ongoing engagement and being aware of what you're asking when you're asking people to engage. And so just to sort of go back to how we started our story around the gender-based violence project, and my initial concern that we didn't know what that was going to be used for. So we were going to ask people to speak about really vulnerable issues with no sort of clear path as to next steps. And while I think the process was good, I will say that as an organization, we have never received so much online hatred and threats of violence as we did with this project. And we've done projects on suicide prevention and sexual violence and lots of different issues. And on a daily basis, we had to go in and clean up our social media accounts, for instance. And so just to think about when you ask people to engage in these conversations and to engage in processes, that you're asking them not only to share their vulnerable experiences, but actually, potentially to increase their exposure to violence as well. And so just to be really cautious of that as organizations, and making sure that you're listening to people about how they want to engage, resourcing it properly, and then evaluating it so you know what's happened.
And so when it comes to, this is basically our wrap-up point. I want to highlight a few resources that are available out there. We are, of course, required to talk ourselves up a little bit, and so we are here if folks are looking for access to more training to support engaging communities and being intentional about that engagement. If you're looking for support around mobilizing knowledge or convening groups, my own expertise, my life is LGBTQ inclusion training with organizations to help build that capacity and do that internal agency work. And so give us a shout. We'll bring up our email slide or our contact info in a moment. There's also great organizations like Rainbow Health Ontario that offer more clinical expertise. A resource that I hear folks needing more and more often are for parents of trans and gender diverse kids. And the Canadian Parents of Trans and Gender Diverse Kids organization and group is the best one that I've seen. It's peer parent led, and the parents there are really incredible. LGBT Youth Line is Ontario based, but they offer peer support and a variety of other services by and for LGBTQ young folks. And then the Canadian Centre of Gender and Sexual Diversity does a lot of national convening of groups around LGBTQ issues and brings a lot of expertise there. I want to thank you folks for taking the time to join us today, for sticking around a little bit longer. This has been a thrill to connect with you folks. The questions here were really valuable, and I really cherish and I'm thankful for the vulnerability that it takes to ask some of these questions and for the knowledge sharing that happened throughout this discussion.
Wow, thank you very much, Faye and Lisa. That was very, very informative, and I very much personally appreciate learning more and seeing. I know we can take a few questions, folks, but I think maybe what we'll do is in the Q&A, we will copy the links that people put there. We'll make sure that goes out in the email when we let you know the link for recording is live, so you can see some of those things that people provided. I know Lisa was going to ask this, and somebody asked, what do you see as how do you see gender and sexuality evolving? It says 50 years, but let's say over the next 5-10 years.
Oh, that's a loaded question. I love it.
Yes.
Do you want to go first?
Yes.
Yeah, go ahead. Yeah, I was trying to think between what do I think will happen and what I want to have happen. So yeah, so go ahead.
I think in 10 years, I want my language to be outdated. I want us to be using different ways of thinking and critiquing and unpacking gender. I hope in 5 years that we live in a world where folks of diverse gender identities can be safe in public. I think that we don't realize, I say this a lot, but I'm not safe in public, and people who are connected to me, my friends, my families, my community members, also experience a lot of violence in public, and I hope that in 5 years we're beyond that. I hope that in 5 years people have access to the basic safety that's afforded to others.
Yeah, I mean, I think, this work we did engaging young people and what we see happening across the country, I think things have changed a lot. And, as everyone can see, I'm not a youth. And so my own experience, was that people weren't out in high school even. And people had to sort of really move out of secondary school and away from home, in terms of coming out, and things are definitely changing. But at the same time, anecdotally, I know, parents in my community who've had trouble with their young person transitioning, and and really, so that cycle of creating unsafe spaces at home for young people who then need to seek services for support, it still is a very real factor in young people's lives. And so obviously moving to a point where young people can be safe in their families and be safe in their schools and be safe in their communities is really important.
Mm-hmm.
Thank you for answering such a large question, and I really appreciate that. I mean, one of the things as we wrap here that I really take away, and I think you said this very early on, is that the conversation. And I mean, one of the things here at CPHA we've talked a lot about in our work is normalizing the conversation. These are not easy conversations. A lot of people have not received training. I mean, this wasn't part of their academic careers, and so it's something that we all have to learn, and it's something that we all come from different perspectives, and we bring a bias that most of us don't even acknowledge we have. And I think starting with that, normalizing the conversation, it's a really big thing, and becoming more comfortable, and I think understanding. So I really appreciate everything you've talked about. I think language is the other thing, and it's mentioned. I mean, there's some great resources. We've just circulated a new one about language matters. It does matter, and it does evolve. So what we have today, and I think Faye and Lisa, you both pointed that out, in just the terminology is, and people see terms and often don't understand. And I think the good thing is, if you don't know, ask. And I think that's what's important. So And I think if it's when you don't ask and you make those assumptions, people begin to feel marginalized and ill-treated. And if you're not sure, ask people. So I'll leave the last few words to you, and any parting comments you have for people to how to get started.
I think what I would say is I really want to challenge folks to like be those champions in their workplaces. I do so much, like I am tired of the 1 hour workshop model when it comes to like staff training. We need to move beyond it, and organizations need to reach out to communities, reach out to folks who've been doing this work and who have the expertise on these issues. Because they can bring you the best practices, can bring you the examples of policies that you can implement, and can answer those difficult questions and help hold the hands of your workplaces and organizations to doing better. I think that we have come so far, but we still indeed have a long way to go. Lisa?
Thanks so much, everyone.
Awesome, thank you. We'll let you folks go on with your days, but thank you for chatting with us. Again, shoot us an email if you have any questions. We're happy to answer any questions or send along resources, and I hope that your afternoons are joyful.
Great, thank you.